Welcome back, Lario. Thanks again for joining us back on the program. So today we're discussing the family's process in terms of how treatment works. So I think we're going to start with the first question. So family members generally struggle at times with people with getting their loved ones into treatment, right? From the perspective of that of the person not necessarily being too willing to get into treatment. How do you facilitate that process?
Okay, well, I think, Ryan, as you said, it is a process. So I think there's certain steps that a person can follow. I think step one would obviously be to address the patient. And I think there's specific ways in how to address the patient when you are wanting them to engage into treatment. So I think what I've found is mostly beneficial is when family members address a patient one-on-one on an individual basis rather than as a group. So I often get feedback from the patients telling me they felt extremely ambushed or attacked when they walked into a room and they were their 5 closest family members or relative or friends, wanting to have an intervention. I think having a one-on-one conversation with the patient at the end of the day could be more effective. I think also it's something to really consider is the time and place for addressing the patient. So at the end of the day, I've often found that family members would tell me I've attempted to engage with the person, and every time they become extremely aggressive or, they're quite defiant or manipulative, and then, I often find out later that they approached them while they were under the influence of substances.
Okay.
So probably best to address them whilst they're sober. Also to consider, in which environment you're addressing them. Probably best to address them in a place where they feel safe and where they feel comfortable, a familiar surrounding. And then at the end of the day, when having the conversation with the patient, it's very important to start by validating the patient's feelings. Okay. So you need to try and consider what type of position is this person in. Okay, so the patient is often very aware that they have reached a point where things have become unmanageable. They're feeling powerless, they're feeling lonely, they're feeling misunderstood. So it's important to validate those feelings in order to identify to them that you do understand that they are going through a difficult time. So that is something to consider in terms of, explaining to them that you've thought about or you try to put yourself into their shoes. So coming from a softer angle in order to try and relate to what they're feeling is often a good conversation starter. Secondly, yes, sorry.
So, I'm imagining that would probably be very difficult for a family member that sort of had a lot of sort of had a lot of negative experiences with their family member that's in need of treatment, right?
Yes, and I think that's why it's important that you also check your emotions before you engage with the loved one. I mean, at the end of the day, if you are if you gonna act impulsively or whilst you're in the middle of your own emotional breakdown, it might come across, a little bit more attacking or aggressive, where it's important to make sure that you're calm and that maybe you've had a space where you could give out on your emotions. Maybe you've entered into your own therapy process or you've discussed a little bit with other individuals in order to make sure that when you do address your loved one that you are calm and that you are able to convey, those and like I said, validate their emotions. So that's definitely important.
So you're saying that the typical sort of like intervention that takes place in a sort of lounge or dining room area where all the family members and the friends are present and they're all sort of like sitting in a circle and they've all got a lot to say to the person who's in trouble here. You're saying that that's not necessarily the most effective way of doing it, say?
I would say attempt to start with the one-on-one approach, and if that doesn't work eventually, then all the loved ones that have spoken to that person one-on-one can then come together. But again, it's how you set up that intervention. There's your body language, your tone of voice, the way in which everybody is positioned that can really have an effect at the end of the day. So and I think it's also important, which I have found is that in order to try and engage with the facility or the rehab prior to the person being admitted and maybe ask them if, you can come through with the patient prior to admission, so that they can see the place, they can meet the staff, they can, maybe talk to fellow inpatients, and I think that lessens a lot of the anxiety when they do eventually come for admission, because then they feel there's some form of familiarity or some form of rapport that's already been established.
Okay.
And I think upon such visit, it would also be beneficial, that they get maybe assessed by one of the healthcare professionals. Specifically, going on our previous podcast where we spoke about dual diagnosis, if a psychologist can do a thorough assessment before admission, it can also determine whether rehabilitation or psychiatric admission would be the most appropriate intervention or initial intervention. So as we said, many substance abusers unfortunately struggle with dual diagnosis as well. And sometimes when they're acutely psychotic or when they're acutely suicidal, it might be more beneficial or effective for them to be admitted to psychiatric first, or to receive psychiatric intervention first, so that they can be stabilized and then carry over to the rehabilitation program, where they then might be a little bit more able, or it would be more, let me just think about the word here.
So they'd be stabilized, psychiatrically stabilized, right?
Yes, and that would make them a lot more capable to actually internalize the therapy that they will actually receive at the rehab itself.
Okay.
But I think, obviously these are steps that one can follow, but if that turns out to not be effective and the person is completely resistant, maybe, like I said, very aggressive, sometimes I get family members that tell me they're actually fearful, they're fearful of the loved one, fearful of their aggression or the way in which they might respond, then it would also be beneficial maybe for the family to book an appointment at the facility to come and talk to a healthcare professional on specifically how that patient, what would be the best approach in addressing that specific patient. Because as we also said in the previous podcast, every patient is different and presents differently. But these are pitfalls that I often find family members fall into, is that they all throw a bit of a blind eye, or they wrap the person in cotton wool, and then all of a sudden on one day they take a very aggressive, overt approach, which kind of either scares off the patient or heightens all of their defenses, which may often just eventually postpones or delays the admission to the rehab process.
Look, one of the first questions I ask somebody when they call for a family member that they need to get into treatment is the person willing to get into treatment? Yes. How do they feel about it? And on occasion, people say that that the person's not willing. Okay, they're not interested. I don't know how to help this person, right? So, what sort of steps do you think we can take? Aside from an intervention or a one-on-one conversation, to motivate this person to get into treatment?
Well, I think there's a lot of stigma surrounding rehab. We've all watched Carte Blanche, and I don't blame a lot of people, that they might already be quite cautious of entering into a rehab program. There's been several stories going around, what if I go in there and they lock me up for a year? Or so then I might suggest to the family, why don't we just book a initial one-on-one therapy session for the patient? Let them come to the facility, but they're not necessarily going to be booked in on day one. Let them sit with the psychologist. Let the psychologist help them understand the significance of rehab, exactly what happens in a rehab process, how long the process might be, what it entails, and that might take 1, 2, or 3 sessions for them to then get to a point where they feel, okay, well, you know what, I've come to my own realization. I've come to a point where I myself have, identified or that they've kind of broken through that denial to say, you know what, I think I need this, not the family thinks I need it. Or so that might be a slower approach, and I know that often the families feel that we're in a sense of panic or emergency, and there's no time to have weekly sessions to get to a point where the person buys into the process, but that might be a good option. Or then otherwise, like we said in the previous session, to book an appointment for them at the psychiatrist, because the psychiatrist can also explain to them from a medical stance point what the risks are should they continue abusing the substance, which I think a lot of them don't really take into account, because I always say to my patients, you can't look inside your own body. So you think that you might be still doing okay, or, until they get kind of given the facts of, listen, yeah, this is what might be actually happening in your brain or in your actual body to your organs, which also might get them a little bit more motivated to buy into the process.
Okay, so you're saying work with the patient on an outpatient basis to kind of motivate them to understand that there might be a level of denial going on, and sort of like help them sort of transcend that denial, right? Okay.
Yes, and I think what I've also found, what some of my patients have told me, is they went for support group meetings first, Alcoholics Anonymous or Narcotics Anonymous, where they got to meet other recovering addicts that obviously went to rehab themselves. And hearing it maybe from somebody that's been there, that went through the process themselves, they also feel a little bit more like they trusting the person's opinion because that person went through what they went through, So there's several options that a person can consider. But I think it's often, like I said, the family do feel panicked, and they do feel like it's an emergency. And I think sometimes we do need to just put things into perspective to say, you know what, like I said, it is a bit of a process sometimes in getting the person to buy into the program.
Well, I think that's an important point. It's quite easy to sort of build rapport with somebody if you have been through what they've been through, right?
Yeah.
So like it kind of like with psychologists kind of takes a little bit of a longer period, it's a longer process, But if a recovering addict sort of sat down with somebody and said, "Hey man, look, I've been through what you've been through, understand what's going on," and they sort of have that conversation, the rapport sort of like instantly sort of appears, right? So I think, that sounds like a good angle, as well as maybe finding somebody who's been through the process and have them sort of explain it to the person, right?
Yes, and then like I said, I mean, obviously it's every person's situation is specific.
Sure. Yeah.
So I do get a lot of phone calls where family members says, but listen here, the person is locked in their room. They're not at all even willing to open the door, never mind get into a car with me to take them to a meeting or see a facility. And like I said, then I would really urge the family to book an appointment at an actual rehab or facility so that they can get some more in-depth, advice on how to deal with a case like that, which is a lot more severe and a lot more acute and might need a more medical, approach in the beginning.
So what about sanctioning somebody? So putting boundaries in place, like if you don't go to rehab, I'm going to divorce you, or if you don't go to rehab, you're getting kicked out the house, and like, things like that.
I think that's very tricky. I mean, at times, yes, you might instill fear in the person, and they might actually then eventually come to rehab, but not necessarily for the right reasons. And then we often find they're very resentful towards the process because they feel forced and they feel like there's no option in the matter. There is times where they get swung during the course of the program where they then via all the therapy and speaking to the other patients, kind of break through their denial and commit to the process and the program. But a lot of the times they kind of, they're just doing it to avoid the ultimatum or the punishment.
So on that note, I mean, people that are forced into rehab by means of the family using leverage to kind of motivate them, right? They come in, like you say, they can be resentful or angry at the process. Aren't the professionals equipped to deal with those different levels of all those different feelings and kind of like help them motivate a different outcome?
Definitely, that is something a person can do. I think the thing the aspect we want to avoid is that the entire therapy process is surrounding dealing with their resentment or anger feelings towards the family for having forced them in the first place. Because then we often lose out on very valuable therapy time where we're actually supposed to deal with the root cause of the addiction.
Sure.
Or we need to start working on other triggers. But then we often see that a huge chunk of the therapy just is about containing them in terms of their feelings about having been, like I said, pressurized in the first place.
Sure.
So I think it may be important, for a family member to, when they do address a patient, to say, you know what, obviously I am wanting you to go to rehab because I love and care for you, because I have your best well-being at heart. But in terms of boundary putting, they can say, well, you know what, because I love you and care for you, I can't be an enabling factor in your self-destruction. So if you choose to continue self-destructing, I can't play a role in that, whether that be supporting you financially, whether it be, excusing some of your bad behavior, whether it be rescuing, so maybe covering up or lying on behalf of the person. So those things, as soon as you start minimizing those type of enabling behaviors, they often get to a point where they realize, sure, but now, I can't maintain my addiction because I don't have these enabling factors. And at the end of the day, then, they often also then more inclined to commit to the rehab process. So I think there's different ways of putting boundaries in place rather than putting a threatening ultimatum in place, if that makes sense.
So how does a family remain supportive without abandoning the person, but at the same time have boundaries in place and not enable them?
So I think the main thing is to not withdraw completely from the patient. So every day, almost consistently communicating that you're there for the person, that once they are ready to commit, you will be there to help them through the process. But like I said, when they do come and ask for money, or they come and they wanting you to, like I said, lie on your behalf, maybe they can't go to work and they want you to make up some excuse for them or whichever, that's where a person then very firmly need to say no. And like I said, keep the boundary in place. So I think what I often find is, family members and I get it, the family members also have their own level of emotional capacity. So on the days where the family members are feeling, where that they're in a good emotional space, they're more effective in keeping boundaries in place. But days that they are also struggling, or they might have had a difficult day at work, or they themselves are drained and exhausted, they tend to kind of give up on the boundaries, and they tend to say, oh, you know what, just take my purse, or just, it's fine, I'll just phone and make up because I can't deal with this right now, and just that little bit of a gap, I think, takes a person a few steps back, and then you need to reinforce boundaries again. So I think not withdrawing completely, but at the end of the day, like I said, putting consistent boundaries in place and sticking to them, that's the important part, in terms of supporting.
Okay, so if you tell your husband you're going to divorce him if he doesn't go to rehab, you better divorce him when he doesn't go to rehab, right? I mean, like I've had it often happen where family members have called me and they're like, I've told this guy 100 times I'm going to divorce him if he doesn't get into rehab, and I'm like, well, that's the problem. You need to tell them once, right?
Yes.
So be careful. I think that's a very important thing to know is you've got to be careful what boundaries you set and what consequences are going to follow. Because if you don't follow through with those consequences, you send a message to the person, inadvertently that what they're doing is okay and their behavior is okay.
100%, and they call your bluff on it, at the end of the day. So I think it's very difficult, and that is where you need a united front. It doesn't help, let's take a set of parents, it doesn't help the mom says no, but dad behind the scenes says, okay, it's okay, I'll just, we'll just cover up. I often find that family members would tell me, I lied on behalf of the loved one to my husband, or, in order to not get the person into trouble or to not upset my husband. But then at the end of the day, like I said, it gives the patient a lot more room or wiggle room to play two people off against one another. So I think everybody also, that which we said about interventions, it is still important that all the loved ones comes together to discuss which boundaries they're going to put into place, what the consequences are going to be, and then everybody needs to consistently apply that across the board.
Okay. I think it helps to have supportive family members or supportive loved ones if you're an addict, right? Generally speaking, I think by the time a person gets to the point where they need to go into treatment, it's almost inescapable that things have become unmanageable, right?
Yes.
The cracks are, generally speaking, very clearly showing. So it's not always the case that a person, knocks on our door and says, listen, this oak doesn't want to go to rehab, he's in denial. What do I do? That's like, I mean, what percentage of or how often do you think it's the case where generally speaking, people are in denial or they don't want to come into treatment?
So yes, I think we get quite a lot of patients that would come to us to say, you know what, I admit that I have a problem. I can look at the facts, I look at the evidence, I can see that my usage has increased in frequency and intensity. I might be starting to mix certain substances even. I might be starting to use before work or every evening or so, but it's as if they're trying to bargain to say, but I still believe that I can do it by myself, that I can rein everything back in.
Yeah.
So they often come with suggestions on in order to avoid actually committing to inpatient treatment. Just give me a chance so that I can try this and this and this and this by myself first before I then actually go into an inpatient facility. And I think that's normal. I mean, I think we as human beings, we always want to take the easy way out.
I mean, I don't think there's any other kind of illness where people say, oh, no, I don't need help just yet, when it's like glaringly obvious that they do,
Yes.
and they say, oh, no, I can sort this out on my own. It's like,
Yeah.
it doesn't happen with any other illness. I wanted to just talk about, where somebody might have a very functional life, okay, or something that appears to be a very functional life. They're making money. They haven't lost their job necessarily.
I think and that's kind of common these days. I mean, we see people hide behind all these terms. I'm a functioning alcoholic, or I'm a binge drinker, So, and I always say to my patients that I think people come to rehab, especially their first rehab process, they come to rehab to prove that they don't need rehab. They're like, I'm going to go to rehab and prove to everybody around me that I'm not, like those people. And I often find that, they'll book in the first day, they're quite, conveying desperation and relief for the fact that they've committed to the process. 3-4 days later, they'll come to me and say, you know what, I don't think this place is 100% for me because I'm not really like all these people, I listen to their stories and I always say to patients, never compare yourself to somebody else when it comes to addiction. You will always find somebody that you can consider having been worse off than you, or which is an extremer version of addiction. At the end of the day, compare yourself to yourself. If you a year ago used to drink or use on a Friday or a Saturday, and currently you're using every day, once a day, you've already escalated with about 1,000% in a year's time. So how is that going to look in another year's time and in another year's time? So it's not about saying, shoo, I'm listening to this person's story or that person's story, and clearly I'm not an addict because I've never stolen from somebody, or I've never lost a job, or nobody has ever left me or divorced me because of the substance abuse. That should be almost a realization that you can count yourself lucky or be grateful for the fact that your disease hasn't progressed till that point. Because if left untreated, you will eventually end up there. But as you said, it's very difficult for somebody that has the means to maintain a certain lifestyle for them to get to believe that, because it is a sense of belief. You need to believe that, listen here, if I don't get the help now, this is going to escalate eventually to a point where no amounts of money or no supportive relationships will be a buffer against the negative consequences of addiction.
I think if you're in a position as well where you set your lifestyle up with people, with friends that kind of enable that sort of belief that things are okay and things aren't as bad as they need to be for you to go to treatment, right? So, like having a group of friends that all behave in similar ways, right? So, and kind of like thinking that it's perfectly normal to wake up and drink at 10 o'clock on a Tuesday morning, because there's this group of individuals that are all successful too, and they also sort of behave in this way. So, I think it must be incredibly difficult for, and there's family cultures as well. I mean, I know you got the special interest in family dynamics, right? I know that you do get family cultures where it's almost, it's acceptable to wake up and, like I said, drink on a Tuesday morning at 10 o'clock.
Yeah.
When everybody around you is kind of saying, this is okay, but in reality, you're drinking yourself to death or using yourself to death. Like that must be so incredibly difficult, eh?
I had a
Yeah.
patient yesterday in group therapy that said, why are we always so fixated or only focusing on the negative triggers for a relapse? We're focusing on depression and anxiety and this and that and the next thing. Why are we not focusing on the everyday triggers? When we asked him what he meant, he said, well, I come to rehab and everybody is so concerned and saying and panicking and saying, we need to get him off of the alcohol. He can't drink anymore. 2-3 months goes by after rehab. There's a special occasion like a wedding or a birthday, and the person said, I get offered a glass of champagne. And they say, oh, but you're fine, because you're not drinking because you're depressed anymore. You're not drinking because you lost your job. This is just a joyous occasion. You can share it with us. You can enjoy it with us. And they're not realizing the impact for that person the next day or the next couple of weeks following that event, So, and he said that's so difficult because as the recovering addict, I mean, the level of self-discipline when you get pressurized to now enjoy the substance is a lot more difficult at the end of the day, and it's not saying that everybody now needs to stop using or stop drinking around the person in order to protect them, because that's unrealistic. Life, our society won't adjust to one person at the end of the day. But those are things that people need to understand, is we can't pick and choose when this disease is active. At the end of the day, this is a consistent, chronic, lifelong thing that a person will have to work on. And as you said, lots of my patients tell me their friend group or their family group is a big trigger for them, because, when things are rough and bad, then they have lots of opinion about them drinking too much or using too much. But then when the, like I said, the panic or the whatever has subsided, and everybody is a bit more calm and things have stabilized, then, they're often of the opinion, oh, but now we can enjoy something again. You have control now, you've been detoxed, you've gone through the program, you will be able to now go back and let's use alcohol for